Welcome back. September is Suicide Prevention Awareness Month. The topic is often stigmatized or taboo. So today we're trying to bring it to the forefront for those who might want more information about it. We're going to share some numbers to kind of get you caught up as to how big of a problem it is. Now, according to the Centers for Disease Control and Prevention, suicide claims a life every 11 minutes. Think about that. 125 lives daily here in the U.S. It is the 12th leading cause of death in our country, but the second leading cause of death for people ages 10 to 34, younger people, even children. Here today to help us learn more about the warning signs, to help spread awareness about this and share some solutions when it comes to suicide prevention is Melissa Tolstica, the clinical director of the Hegira Health Incorporated. Melissa, thank you so much for being with us today.
Well, thank you for having me. I appreciate it.
We appreciate you being here. What, first of all, are some of the myths, if you will, about suicide that are important to just combat right off the top as we go into Suicide Prevention Awareness Month?
Actually, there are a lot of myths about suicide and suicide prevention. I think the number one myth that we hear most frequent is that suicide is not preventable. Suicide is preventable. We focus on prevention programs. We know that when prevention programs are taken away from communities, we do see a spike in suicides in those communities. So we want to get the word out during Suicide Prevention Month, especially that, there is hope. Another myth is talking about suicide will put that idea in someone's mind. And the reality of that situation is talking about it actually alleviates stress. It allows the individual who may be in a suicidal crisis to talk willingly about it, more so than not. And then one of the other suicide myths is that suicide only impacts individuals who have a severe mental illness. The reality of that is that suicide doesn't discriminate, and it can impact anybody. We have to think about a lot of factors other than genetics and biological factors. There are environmental factors and trauma.
Yeah, and I want to kind of dive into that a little bit deeper, if you'll allow me. We obviously know that suicide impacts people at all socioeconomic levels, but are there certain populations at a higher risk of attempting or dying by suicide? We saw that number, 10 to 34-year-olds. Even in that grouping, is there a demographic, if you will, that's at higher risk?
Well, there are subpopulations to that. 12.2 million people in the world contemplate, or in America contemplate suicide annually. The last, in 2021, that's what we saw. But when we take a look at the population impacted, non-Hispanic whites and non-Hispanic American Indians still continue to have the highest rate. Within that, though, we take a look at LGBTQ+. We're taking a look at Black teens, boys and girls. And then older adults over the age of 85.
Now, what are some of the warning signs?
There are a mix of warning signs when we take a look at sad mood, a change in mood, an increase in substance use, alcohol or drug use, withdrawing, isolation. One of the warning signs that we see that's important is burdensomeness. So when somebody feels like they're being a burden to someone else, that really requires, some sort of intervention.
Burdensomeness. And before we leave, what can people do to help prevent suicide?
Just to become more educated about it, we offer a question, persuade, refer training, which is a 3-step evidence-based practice that allows individuals to learn how to communicate effectively with those who may be in suicidal crisis. It's hard to ask the question, but we can't be afraid to ask that question. Are you suicidal? And then, of course, know your resources in your community. Know where your crisis centers are. Use the chat line, the text line, 741-741. Use 988. These are all tools at our disposal. So if we can't do it ourselves, we can get help.
Yes, indeed. Melissa Tolstica, the clinical director of Hegira Health Incorporated, thank you so much for shining a light on this issue of suicide and obviously helping people to prevent it.